Hello, welcome to the World of Rare Diseases. This show focuses on awareness and education about rare and complex disorders. I am Julie Gertze, founder of Rare New England. Over the years, as a nurse, a patient advocate, and as a rare disease patient myself, I have often seen a correlation between patients with complex health problems and symptoms of depression and anxiety. They seem to come hand in hand. Today we'll be talking about depression and anxiety in the rare and complex disease patients and learn avenues for finding relief for those individuals. Here with me today is Lois Foster, a clinical social worker in private practice. She has experience working with patients with complex health conditions. In addition, she is a member of the Rare New England Board of Directors. And also with me is Dr. Richard Barnum, who is a child psychiatrist in private practice, with much experience working with both children and adults with uncommon and complicated medical conditions and psychiatric conditions that go along with them. He is also on the Medical Advisory Board of Rare New England. Thank you both for being here today.
Thank you for having us.
Yes, thank you. I think I'd like to jump right in there and possibly get definitions. Could you describe, Dr. Barnum, what exactly depression and anxiety are?
Well, anxiety and depression are both conditions of emotional distress of one kind or another. Anxiety basically refers to a state of being in fear with no specific threat immediately pending. So it includes generally feelings like maybe butterflies in the stomach, some tremulousness, difficulty catching one's breath. It's a common experience. Everyone has it, one time or another, and usually it's associated with stress. It can be sometimes related even to threats that are sort of completely obvious. For example, the threat of making a fool of oneself when on a televised interview would cause anxiety for many people. But more seriously, it can be enormously disabling. One of the things that can contribute to anxiety is experiences of having been traumatized in the past in all kinds of different ways. Specifically, what I'm thinking of is people who've been traumatized by the experience of being sick and yet going to doctors and being told that they're not sick, that they have some sort of emotional difficulty that is making them appear sick or have symptoms of one kind or another. And that's something that can be very disturbing for people. And I've seen people experience so much in the way of anxiety in response to interventions like that, that they basically don't go back to doctors anymore, and they end up sort of without care for things that are actually really very much in need of care. When anxiety is severe, it can contribute to profound withdrawal from other people, from all kinds of life activities, and be incredibly uncomfortable and disabling in all kinds of ways. Depression is a condition of basically lacking motivation to carry on with living. It usually includes feelings of hopelessness, helplessness, low self-esteem, often at least thoughts of killing oneself, often even actually making efforts and sometimes succeeding in killing oneself. It can be quite a severe threat to life, in fact. Anxiety and depression often go together. Feeling anxious, especially significantly anxious, can contribute to withdrawal from, as I said, all kinds of life circumstances, which in turn becomes depressing and undermines one's confidence and one's interest in carrying on with life. And being depressed is a genuine threat to life and to involvement in all kinds of things, and as such, it generates anxiety. So it's not a comfortable thing to be depressed often.
Now, I think any one of us out there has experienced the panic and the anxiety at one time or another. Usually, it may correlate with, certain situations. That's, car accident, near miss of the car accident. We feel that, the adrenaline rush and the
Right.
heart pounding. Even nausea can come out of that, all of these different
Sure.
symptoms. So I think we can all relate. But we're talking about patients then who there is no, they may not be in imminent danger, and these people are actually feeling symptoms of anxiety, right?
Sure.
Mm, okay.
Yes. Yes.
Yeah. All right. Now, with depression and anxiety, a lot of the patients, that I've spoken to, they seem to have symptoms of both anxiety and depression. Can you have one without the other? How do you distinguish between the two? Is there a difference of treatment?
Lois?
Sure. Yes, you certainly can have one without the other. A lot of times, I would say, in my experience, I've had patients experience both anxiety and depression, and so at one point in time, we might have anxiety on board. The anxiety starts to subside a little bit. They get a little relief, and then they have depressive symptoms, or vice versa. I'm sure you probably have experienced that as well with patients, and that that is not uncommon. And you do treat, each, for each, I should say, depending on, what is occurring at the time, what the patient is reporting in terms of symptoms, where there may be difficulties in terms of day-to-day activities or ability to kind of function. You're looking at that and kind of prioritizing, what's on board and what do we need to be doing.
As I said before, they do often go together, but the fundamental difference is that anxiety is a feeling of fearfulness and depression is an experience of lack of hope and lack of investment in sort of positive life experience.
And I would think that with depressed patients, it's just an overall sadness that
Sadness?
they're feeling.
Sadness, yes.
Is this something, if it was family members maybe around these patients, what would they see in these patients? Because patients are feeling certain things. They're feeling sad, they're feeling hopeless. But how do friends and family recognize that a patient, that their family member might be being affected by depression?
Yeah. So they may see low energy, a lack of motivation, fatigue, difficulty with sleep patterns, sleeping too much, maybe not sleeping enough, being awake, a loss of interest in activities that they normally would have been participating in or expressing or experiencing pleasure with. So I think those would be some of the signs that family and friends would be immediately noticing. So a change in those habits, patterns that their loved one normally would have been showing, displaying, that now is changing.
Okay.
One of the sort of most difficult emotional correlates of both anxiety and depression is this sort of condition of like moodiness or irritability. When people are feeling anxious, people are feeling depressed, they tend to be in a bad mood. They tend to be short-tempered. They tend to be easily upset, tend to be quite variable in terms of their emotional responses to things. And that kind of instability and irritability isn't particularly specific to either one of the states of anxiety or depression. It tends to go along with both.
Okay.
It's a common sort of non-specific sign of distress.
Okay. Now, I know with a lot of the patients and families that I work with, many of them have problems with depression and anxiety. Why would there be? Why are so many people who are living in the rare disease world affected by depression and anxiety?
I think rare disease patients, there are so many intangibles and so many stressors that they just tend to be susceptible. It's sort of like creating the perfect storm. And thinking about what are some of those contributing factors that they're experiencing and that family members see. There's a lot, around diagnosis, delayed diagnosis, multiple medical appointments, the loss of time from work or school, the cost of medical treatment, co-pays, testing, changes in a family's budget, financial hardships that are created from loss of work or time at work. And I think all of that, really are variables that set that up.
It's perfectly natural when you're sick, when you have symptoms, to be anxious because you don't know. Well, it's especially appropriate to be anxious when you have symptoms and you don't know what the problem is, because it could be anything.
Yes.
And you could be, ready to drop dead without even knowing about it. And so it's a perfectly natural adaptive response to be anxious. And so when people have symptoms that are unexplained and that continue to be unexplained despite multiple visits to doctors who are supposed to know things and be reassuring and help with these kinds of problems, the anxiety tends to increase. And then over a period of time, the more the symptoms continue and the efforts at care are not successful, the more one tends to lose hope, to experience demoralization and lack of confidence, sometimes even feelings of self-blame, as though somehow these problems are the person's own fault, or that they should somehow be coping better with them, and therefore they feel badly about themselves and their own abilities. So it's pretty uncommon, I think, for people who have been struggling with rare diseases, especially rare diseases that have really significant symptoms and are difficult to diagnose and treat. It's very uncommon for people like that not to be suffering from both anxiety and depression. On the other hand, it's also true that anxiety and depression, are relatively common experiences in the general population, even among people who are not suffering from other kinds of physical conditions. They tend both to be genetically modulated and transmitted, and so there's nothing to stop someone who has one kind of rare disease or another from also having anxiety and depression that's completely independent in its source anyway. On the other hand, it's not going to be completely independent from the experience of having a rare disease, because it's really hard, it's stressful to have a rare disease and to be suffering from the symptoms and the difficulties getting care and so forth.
And that's true. I mean, I could vouch for that if the physicians and the people who are supposed to be the ones taking care of you don't understand what's going on and you are sick, it's really frightening.
Yeah.
And that does cause a lot of anxiety.
Yes.
I've also seen with patients and families when they have someone in the family with a complicated illness, there's also the financial problems. There's, you know, parents may not be able to go to work. You know, there's the feelings of isolation
Yes.
because people don't understand what's going on. And to touch too a little bit on Dr. Bondon, when you were talking a bit about the blame, how they like blame themselves, I have seen some of that also in some of these families where the parents may not have even known that they had a rare disease. The child is really sick. The child gets the diagnosis, so the family is then tested.
Yes.
And then that's when the parents find out that they're actually carriers
Mhm.
for that genetic disease. And there's nothing they can do about that. Of course, it's not a fault.
Right.
But I just see a lot of these parents walk around with that huge guilt that they gave this disease to their child.
Yeah.
So that can be
Mhm.
that can be really rough. Well, you know, in the rare disease world, where there's approximately 7,000 rare diseases, and only 5% of them have an FDA-approved treatment. This makes it very hard, I think, for these families who are dealing with their rare disorders. They're obviously in this for life, so they're more apt to have the depression and anxiety.
Yes.
What do we do for these patients? What kind of options do we have to help these patients to feel better and be able to cope better with how they're living?
I think, you know, I would encourage them to, one, be their own best advocates, to find a provider, you know, encourage them to seek help, to find a provider, not to be afraid to look at advocacy groups or outpatient counseling or whatever might work for them, to look, you know, at their own individual needs and their medical needs, and to find somebody that's willing to work with them, maybe think outside of the box to help meet those needs. And to do the same with family members and loved ones, to encourage them as well, because it is difficult. They do need supports. It's important to have that and to look and say, okay, where might we find those type of supports? You know, what support groups might be out there? What other resources are there, so that we all can be, you know, doing the very best we can to support one another and get through this process together.
There are really two different kinds of issues that you're raising. One is the challenge of being sick with a condition that is hard to diagnose and hard to treat, and the other is the condition of being unhappy about having that condition. And with regard to the second thing, the first thing that needs to happen is that the person needs to recognize that he or she is experiencing anxiety or depression that is related to or even if it isn't related to the rare disease, but that it is anxiety or depression, because there are ample treatments for those conditions. They generally are pretty effective. Certainly the initial process should be to meet with a mental health professional and get an assessment and determine whether the condition is something that's sort of likely to respond well simply to ordinary counseling, or whether it's something that would benefit from medication. Often these conditions respond best to a combination of counseling and medication. But aside from that, I mean, that's the idea is that when one is suffering from a rare disease and recognizes that one does have anxiety or depression that's associated with it, the right thing to do, the helpful thing to do, is to recognize that and get appropriate treatment for it. But that doesn't solve the problem of what to do about having this rare disease that is overwhelming and disabling and often painful and debilitating. And unfortunately, there's not a lot that can be done to change that condition. Certainly recognizing it, sort of doing one's best to understand that the fact that often people sort of don't see the disease and don't offer any particular sympathy or support for it is sort of a normal thing that happens, and not to sort of be demoralized by that. To understand what it is that can be done to improve one's functioning, and not allow oneself to be completely destroyed by the condition, and to have the right kinds of expectations for what it's going to be possible for one to do or not do as a result of having these conditions, while at the same time, always doing one's best to make sure that what can be done is being done.
Mm-hmm. Now, I know in the rare disease world, I mean, the statistics say that there is an average of 8 years before these patients actually find a correct diagnosis, and they may have incorrect diagnoses along the way. I actually know many other people who are adults who've gone much longer than that 8 years as well. And they've gone from doctor to doctor. And Dr. Bonham, I think you touched on this in the beginning of the show, but they've gone from doctor to doctor trying to find out what was wrong with them. They have these symptoms, they go to these doctors, and the doctors don't know what to do with them. And a lot of them have actually been diagnosed with depression or anxiety as a way to try to explain their symptoms. So we have that problem, but we also have the problem where, when I talk to some of these patients, and I think they might be depressed or anxious, and maybe they would benefit from counseling, or even maybe some of the psychotropic medications, they actually get defensive, or that they don't want to hear it. And I understand that, though, because they've gone all these years with these symptoms. There is something medically wrong with them. Usually they find this out after so many years. So just the idea that, gee, you might be depressed or you might be anxious, they're not going to listen anymore, and they're not going to do anything about it. And I just find that to be very unfortunate, because there is, as you say, I mean, there is that piece where, yes, it's very natural for someone who has a complicated illness and going through what they're going through to be depressed and anxious. Does anyone have any suggestions as to, have you seen that? Do you have suggestions what we can do?
I was smiling as you were talking, because I was remembering a presentation that I went to a number of years ago by an expert in dysautonomia, who was describing her experience of going to doctor after doctor to try and learn what the problem was. And she went to one doctor who said that she was probably drinking too much. She went to another doctor who said, what you need to do is have more wine, because it will help you to feel better and not be sort of so prone to anxiety and whatever. I mean, that's a small example, but with regard to sort of the thing that's outrageous is how painful and traumatic it actually is. This is especially true for children, I think, to be told that what they're experiencing is not a real thing. It's not a real symptom. It's in their head. It's imagined. It's just, you're probably just under stress. You're probably just nervous about something. I bet there's a great deal of stress in your life, isn't there? I think probably it would be good for you to probably see a counselor, someone who could help you with your stress. And I think probably everything will be fine after that. The fact that you're, occasionally vomiting blood, the fact that you haven't had a bowel movement in a week, those things probably don't really mean anything in terms of your physical state. It's outrageous. I mean, it's the kind of thing that is just incredibly upsetting. And
so depression and anxiety cannot cause these things you're talking about. Right? Is this usually?
It can happen that that anxiety can cause certain kinds of mild to moderate gastrointestinal disturbances, but and certainly other kinds of aches and pains from time to time. But it's not. It's very uncommon that any kind of serious physical symptom is caused just by anxiety or depression. It's much more common that there is some kind of underlying physical process. Whether it's something that actually falls within the 7,000 recognized rare disease categories, or whether it's something that hasn't yet been described and recognized and characterized, is anybody's guess. But it's most commonly some kind of genuine disturbance in ordinary sort of normal anatomy or physiology that is causing the problem. And when people are told that it's not a real problem, it's just something that is, relating, it's a manifestation of being nervous or depressed or stressed or whatever. It's just, it causes really profound unhappiness, anger.
Sounds frightening.
It's not just it's enraging. It's like what kids that I know experience when this has happened to them is that they want to tear their hair out. It's people don't get it. Nobody's listening. Nobody's really taking this seriously, and that can have all kinds of really terrible consequences in terms of contributing to further anxiety, contributing to further depression, and also interfering with the person's willingness to seek mental health care that could actually be helpful, because to seek it would be to somehow admit that, that they're right, that it's not a real thing, when it could actually be really a helpful adjunctive treatment to whatever else is going to turn out to be helpful for the condition.
But that's the point. We need to find out what's wrong with these patients
Exactly.
physically,
Right.
while helping them with the emotional issues that they're going through.
Right.
Yes.
Yeah.
Yes.
And I do know too, talking with a lot of these patients, they tell me that people don't understand. I mean, these patients are ill. People don't understand what's wrong with them. This actually can cause some isolation in their lives. Maybe they're sick enough that they can't get out, they can't be social. They are even uncomfortable being with their friends because their friends don't understand what's going on. So their friends and their family, I think for the most part, they're well-meaning. They want to understand, but they just don't understand what's going on. And so these patients are hearing things like, well, gee, if you would just eat better, if you'll take walks, just get out of the house once in a while and you'll feel better.
Look on the bright side of things.
Yes, yes.
Walk on the sunny side of the street.
Yeah. So true. It's so true. But it's so sad for these patients because they, they're not getting relief. They really need the support from their friends and their families. And does anyone have any suggestions how would they be, because obviously it would really need to be the patients trying to explain to their family members and their friends, and hopefully if anyone's watching the show today, they're learning something so that if they do have a family member who's battling this, they'll have some clues. But I mean, how do we help them so that they don't feel so alone when they feel they don't have their families and friends?
Yeah, that's a great question. I don't know that I have a foolproof answer, but some thinking on that. I think the more that patients have information and awareness and education, the more that they too might be able to share with family and friends and helping educate them and bring that awareness to them. It's sort of working in reverse, I understand, but sometimes that's the reality of it. I also think on the other side, for family and friends, it's important to You know, they may not have the answer and they may not fully understand, but not to underestimate the power that listening and encouraging and supporting and validating really bring to that family member or to that friend. So I think it goes both ways. It's reciprocal in that sense, but I think that that's important as well.
Yeah, it makes sense. Yes.
You're talking about the isolation from friends and family that people can experience. Makes me think of one patient that I've been working with for a long time who is pretty significantly disabled, even though she continues to work full-time and do quite well, but is otherwise basically unable to do much of anything other than sleep. And so she has one or two friends, and she has family that actually understand her and her condition quite well, but and are enormously helpful, but are still stressed because it's really hard to provide what a person in situations like that actually needs. So there's no real good answer for that. The thing about family situations that can make things more complicated is that families are always complicated, and you know there are rare families that don't have one or another kind of difficulties with communication and stress and antagonism and so forth within them. And so when those difficulties end up sort of merging with the problems that come from having a rare disease, things get really ugly. The person who has the condition will feel misunderstood, will often be misunderstood. The people who are doing their best to try to understand the condition will find that their efforts sort of fall short because the patient has experience in all kinds of different areas of feeling misunderstood and mistreated, and so again the problems are broader than just difficulties with family understanding and communication of the rare disease. They're also complicated by all these other things that often are troublesome in families.
Mm-hmm. Mm-hmm. Yeah, and that makes sense. And I mean, and I also want to say that with these families, the family members, I do know that they're also in pain. They're also watching this person who has shown symptoms or something, whether they understand that there's really a disease process going on, or whether they really think that this patient is only depressed or anxious. The thing is, they're still struggling and they're still trying to figure out how to help this family member. So, I mean, I think there is a disconnect there in some ways because, if you're really depressed, you're really anxious, and you kind of get into that little cocoon of your own because it's overwhelming what you're going through.
Right.
So sometimes you don't even let your family in. But, I know it is.
It can be hard to let family and even friends and even family in because it can be embarrassing to be sick and to have so little ability to respond positively to it, effectively to it, and I've talked with lots of people who feel like it just isn't worth it. They're not going to get much in the way of helpful support. They don't like when people are like sympathetic about what they're going through because that just sort of makes them feel worse, and they want to be able to feel like they're in control of themselves in their lives. So,
They don't want to be pitied.
Right.
They, you know,
Right.
they want to
Exactly.
be part of, you know, bringing good things too.
Right.
But it's just so hard for them when they're in the middle of all of that.
Yeah.
Yeah, that's very frustrating. Now, what about psychotropic medications? I mean, what kind of role can they play, and when might they be considered for some of these patients?
Well, the current medicines that are available now for anxiety and depression actually tend to be pretty effective and to have relatively little in the way of side effect difficulties. The most commonly prescribed kinds of medicines are the so-called selective serotonin reuptake inhibitors, SSRIs, and the other kind that is similar are the serotonin and norepinephrine reuptake inhibitors, SNRIs. Both of them work by improving the activity of certain chemicals in the brain that act to improve mood, alleviate anxiety, tend to, improve certain other aspects of mental functioning, and they work just as well for people who have other kinds of medical conditions, rare or not, as they do for people who don't have those conditions in general. Although, I guess in my experience, it turns out that there are enough other weird things that can be going on in someone who has a rare medical condition that that sometimes the SSRI and SNRI medicines don't work in quite the same way or with quite the same effectiveness as they may work in other people whose conditions are less complicated. But generally speaking, these are drugs that that can be really helpful in alleviating anxiety, improving mood generally, sometimes even in reducing pain. The medicines usually don't work right away. It's important that people understand that when you start taking a medicine like this, it will usually take at least a week, sometimes 2 or 3 weeks before they begin to work. And it's also entirely possible that, the first medicine that somebody tries won't be the best one, and so they'll need to try something else. It can be a daunting challenge to sort of work one's way through the variety of different options and to make dosage adjustments and so forth. It can be frustrating and demoralizing, and it sometimes can actually contribute to a patient's depression and demoralization by sort of, they take the step of, okay, I'm actually going to try this medicine, and okay, well, it doesn't work, so, oh well, I guess things are even worse for me than they would have been otherwise. So it's important to understand that, like everything else in the medical world, things are not guaranteed, and it often takes a while and a variety of different efforts before things turn out to be working as one would wish that they do.
That actually brings up a subject that I'd like to talk about. But first, I know, Dr. Bonham, you would be able to prescribe medications. Lois, you would not be able to prescribe.
Correct.
But you would still be able to see patients with depression and anxiety,
Yes.
and still make arrangements for them to
I would refer
receive medication.
either to primary care or out to psychiatrist, and then collaborate with that other provider. Yes.
Okay, all right, that sounds good. All right. Now, I know that just recently I have heard about this gene testing, it's pharmacogenomic testing that can be done for patients. I've seen it with medications for ADHD, also for the psychotropic medications like we're talking about today.
Yes.
I actually just learned yesterday they have one for folic acid as well, and I know there's another one I'm not thinking of at the top of my head, but I've been really fascinated by this whole new area to be able to match patients. It's almost like matching patients with their DNA testing. It's actually, it tests the genes to see which medications will be more effective and with the person's specific DNA makeup. And more importantly, it can also flag medications that patient might have severe reactions from. So do either of you know anything about how this works? I mean, to me it sounds amazing. As Dr. Bonham, you were talking about how, it's one of those kind of trial and error for patients, and you figure if they're feeling bad enough that they get to that point that they want to take this medication, a trial and error may not be the best thing for them, especially if it could take 2 or 3 weeks for a medication to even show effects.
Right.
So to me, this sounds like a wonderful new area.
There
What do you
actually
think about
there are a
this?
couple of different kinds of tests that you're referring to. The most widely available and familiar kind of test is the genetic testing of enzymes that are responsible for metabolizing medications. It's relatively easy, I guess. I don't do it myself. I refer to laboratories who do it, but it seems to me that it's pretty easy to get answers to the questions of which enzymes are, which of the enzymes that are responsible for metabolizing medications are normal in their functioning as opposed to being underactive as opposed to being overactive. If an enzyme is underactive in metabolizing a medication, then the medicine will last longer in the body and its level will increase in ways that aren't familiar because they're not normal. If a medicine is overly active in metabolizing a medicine, if an enzyme is overly active in metabolizing a medicine, then the dose of the medicine will need to be increased because the drug will be being metabolized more rapidly than normal, and the level of the drug will not be as high as ordinarily would be expected to be. So all of the most common kinds of genetic testing that happens currently is with regard to enzymes that metabolize drugs, and it's not just psychiatric drugs; it's all kinds of different drugs. And there's a lot of variation in terms of mutations, even normal variations in the way people's enzymes works that make a big difference in terms of what doses need to be used in order to get the right effects. Now there's another kind of genetic testing that isn't really focused on the enzymatic metabolism of drugs, but instead is focused on the sort of ordinary, intrinsic, spontaneous physiology that goes on and contributes to how people feel and how they get along. You refer to the folic acid issue. There is an enzymatic genetically mediated variation in how folic acid is metabolized, so that there are some people for whom the ordinary expectation of folic acid being metabolized in a certain way that then contributes to the effective functioning of the neurotransmitters that are involved in anxiety and depression, it just doesn't work, it doesn't happen. So in patients like that, either what's called for is a need to increase the ordinary consumption of folic acid, which is, I guess, some sort of B vitamin. I'm not even sure, but or to take a special version of it that somehow ends up contributing to the sort of appropriate manufacture of neurotransmitters without having to suffer from the metabolic genetic problem that the person has to begin with. That's really cutting edge stuff, and work in that area promises to be really pretty enlightening over the next 10 or 20 years, I would expect. I would expect that there'll be a lot more things that people will discover as metabolic abnormalities that can be recognized by genetic testing and then addressed by some either specific treatment or nutritional approach or whatever.
Yeah, Chauvet. This
Yeah.
does so much more
Yeah.
to be found.
Yes.
Have you had any experiences?
I have just started to have a few patients who have gone through genetic testing, and the experiences so far really have been very positive. They were both patients who had multiple trials of medication and difficulties and reactions, and so being able to look at, as Dr. Barnum says, sort of which classifications of medications are medications that look like would work well with sort of the genetic markers, how are they metabolizing those medications, what's happening around dosing. And so I'm excited as we're moving forward to see, how that impacts for them. What differences does that make, and where do we go from here?
One of the things that's important to understand about this area of activity is that the testing is expensive, and it's not at all certain that routine medical insurance will cover it.
Well, we
I
have
did-
insurance
I
companies, so
did-
that's another show
did-
for another day.
I did,
Yes.
I did refer one patient for the testing, and she had it, and it didn't turn out to be particularly revealing or helpful, but it did result in her getting a whopping bill that she wasn't expecting, and
Yep.
so
that's
that really didn't help too much.
No.
Yeah,
So
that
that's a
could
good
be
point,
very
checking that out
difficult.
ahead of time to find
Right.
out,
Yeah.
will the insurance cover it? What kind of a, payment might you expect if it's not being covered or if it's only partially being covered?
Right,
Yeah.
right. And I know there are different testing centers, so
Yes.
it may depend on.
The center.
Well,
Yep.
Yeah.
That's
and
true.
I don't have all of that information.
No.
I mean, I do know there was one that I've had some conversations with who they said that Medicare was paying for all of the testing, which that's great, and I'm hoping though that over time, that when people are understanding what this is and the benefits, the great benefits for something like this, and then maybe as they because how is the testing done? Is it credible? Like what is going on with the testing? If it proves itself, then I think over time this would be really excellent. Because I also know in the rare disease world there are many, many, many patients who they are telling us that they're having reactions to medications. They have a very difficult time with certain medications, especially in certain rare disease groups.
Right.
That if you have a certain disease, you can't have this or you can't have that. And it's not really understood a lot, even by physicians.
Right.
So to be able to have testing, if something like that would show, like someone who needs anesthesia, say, if they could test for something like that and know that certain anesthetic is not going to be
gonna
good
help
for that patient.
Right.
Oh my
Yeah.
gosh, what a
Yeah.
difference
Yes.
that will make. So I'm really excited. I'm hoping
Yeah.
to see what happens with that.
Mm-hmm.
With
It
future.
is, the variation that people can show in terms of how they metabolize drugs, how they respond to different drugs, is is enormous, and actually I think makes a big contribution to the confusion that doctors experience in dealing with people who have elusive conditions, because they can, tolerate enormous doses of drugs that would be toxic to other people at times, or they can be extremely sensitive to drugs that don't seem to have much of an effect at a particular dose on other
Right.
people. So that kind of variation, I think, contributes to the sort of puzzlement and the frustration that many doctors often experience with when they're trying to help people who have these kinds of conditions.
That's true. Now, here's a thought too. Now, we all know the high cost of healthcare. What's going on with healthcare in the country at this point. How does that fit in with mental health care? I mean, how are the insurances covering? How are the patients able to afford? I mean, can the cost of mental health care actually be an obstacle for some of these patients?
I think for some patients it can. Patients who have health care, depending on the health carrier and the policy, sometimes benefits are limited. Some are more liberal than others, and depending on the condition. I always like to encourage, depending on what somebody has, is there's usually local resources that are available as well, and so exploring those local resources. A lot of times the community public health nurses may have access to discretionary funds. Agencies have sliding scale fees or sometimes zero fees depending on what type of funding they may have in community agencies. So not to let that cost be prohibitive. Look beyond that or seek out the resources if this is something you're interested in pursuing for yourself. Continue to keep looking, because it is possible, and it doesn't have to be cost prohibitive.
So if a patient has a rare disease and has been involved in all kinds of treatment for that, and in addition has anxiety or depression that calls for additional psychiatric treatment, you're saying that if it turns out that their medical insurance isn't sufficient to cover the psychiatric treatment, that there may be other resources
Yes.
available, and how would they? That's wonderful news, and not something that I had been familiar with. How do people discover those things?
Sure. So some possibilities, excuse me, are United Way 211 is the information and referral hotline. And so calling and specifically inquiring and saying, this is something that I'm looking for. Can you give me a list of those agencies or other resources in the community that might be able to help with some of the cost associated with mental health care? A list of some of the other agencies in the town. So a lot of times there are Catholic social service agencies or Catholic charities will have low cost, no cost programs, even their own counseling programs on site. And again, in each of the towns, the public health nurse or the town nurse, a wealth of information in terms of those same resources. So I would suggest people, certainly start there. Sometimes even their own insurance carriers. There's case managers, so they can talk with them and ask those questions as well. So those are a few ideas.
And as you're speaking, it occurs to me that the state of Massachusetts does have a Department of Mental Health,
Yes.
which is tasked to help provide care for
Care and
people
resources.
who qualify for it, which basically means that they have to have a serious mental illness. That threshold can be relatively high,
Right.
but on the other hand, it's not impossible to meet, and I've certainly seen people who've been able to get enormously helpful services at no cost at all that are funded by the Department of Mental Health.
Right.
And that process involves simply filling out an elaborate
Application.
and waiting for a long time
Yeah.
for it to be processed and so forth, but it's worth it.
Yes. Yeah.
And I would assume that each state has a Department of Mental Health, so if someone watching is from some other state and they're looking for information, that's it as well. But that's also, thank you for offering those resources. That's a really great idea, because I don't think the majority of people actually think to call their town
Right.
health nurse, or
Yes.
you know, some of these other resources that you know
Mhm.
I mean, really they have lists of
Right.
resources for many different things for people, including the mental health.
Yes.
So that sounds really awesome. Well, I think the information in chat today, I mean, this has been, you know, very enlightening. I thank you both for coming. I know that there are a lot out there who do have depression and anxiety symptoms, not just those in the rare disease world. So
Mhm.
I think what we shared, what we talked about today, will be very helpful for the community,
Yes.
you know, in
I
general.
We
hope
hope
so.
so.
Yeah. So, thank you. So now it is time for our R&E and segment, R&E in motion. Before closing each show, we provide our viewers with an opportunity to share comments and ask questions. During each show, we will read questions sent in to us from our previous show and provide answers. Today, we have a question from Dawn. Let me read the question from Dawn. Will the show be seen on cable access stations other than Mansfield? I am a volunteer with the Williams Syndrome Association New England Regional Committee. If there is an opportunity to inform viewers about Williams syndrome, I would be glad to forward information and see if one of our regional experts could participate in the show. Okay. Thank you, Dawn, for asking this question. All episodes of this program will be uploaded to our World of Rare Disease webpage and therefore accessible to anyone. R&E is a firm believer in collaboration between all stakeholders in the rare disease space. We not only want to help spread awareness of the many diseases, but we also want to share programs implemented through the various advocacy groups. Many of these beneficial programs can be transferred across the board into other advocacy groups and help so many other people. R&E will be building our show agenda soon for 2019. Anyone wishing to participate should email us for our request and policy document. We'd like to invite our audience to submit questions and or comments from today's show. We will answer them during the next R&E in Motion segment of our next show. Please send us your questions or comments to info@rarnewengland.org. From all of us at Rare New England and all of the patients and families who keep rare diseases in motion, thank you for watching. And remember, when you hear hoofbeats, think zebras.